Hey everyone, welcome to the Acrobatic Arts podcast. I'm Loren, and I will be interviewing some of the top leaders and innovators from the dance and acrobatic industry. If you are a teacher, performer, student, or a lifelong learner like myself, you are sure to find these episodes intriguing and full of inspiration. Acrobatic Arts is passionate about providing current and relevant information for everyone. So please, sit back and enjoy as we share our passion with you and the world. The month of May is Ehlers-Danlos Syndromes and Hypermobility Awareness Month. And in this special episode, we have Dr. Linda Bluestein back on the podcast to discuss the myths and misconceptions surrounding EDS and HSD. These conditions affect millions of people worldwide, yet they often go undiagnosed or misunderstood. Let's get started with this important topic. Welcome back, Dr. Bluestein. It's an honor to have you join us on the Acrobatic Arts podcast once again.
Thank you so much for having me.
This marks your fourth appearance on the Acrobatic Arts podcast, and your insights have always been so invaluable. In our previous conversations, we've explored a wide range of topics surrounding hypermobility, from its fundamental aspects to the impact that it has on dancers, and also the importance of proactivity in assessment and treatment. As we are in the month of May, it makes our time together much more significant, as this is Ehlers-Danlos Syndromes and Hypermobility Spectrum Disorders Month, which brings awareness worldwide for people affected by EDS and HSD. It's a time when communities come together to show support, share experiences, and advocate for the progress and change that is much needed. So Dr. Linda Bluestein, thank you again for being such a vital voice on this important topic.
Absolutely. And I'm thrilled to chat with you again. And I'm so happy that we are doing this during such an important time. There's been a lot of evolution in this space. And so it's great to be able to update the information from time to time.
And before we start our discussion, could you please reintroduce yourself for some listeners that may not have heard you on our podcast, or even new listeners to the podcast?
Of course. So I grew up as a ballet dancer, really wanting to turn professional, like, of course, so many young dancers. And I started to get joint pain and all kinds of symptoms when I was a teenager. And it really limited my ability to continue on with my dance career. So I realized I needed to come up with a plan B. And my plan B was to go into medicine. And I practiced as an anesthesiologist for over 20 years before I started really having a lot more problems again. And was actually, ultimately, I needed to stop my anesthesia practice. And I actually started a practice with a focus on integrative pain care, because that is an area that is so desperately needed. It's not something that I really, originally sought out to do, but as I worked on improving my own health, because I do have a hypermobile EDS diagnosis. And I really had found so many things that had improved my quality of life. And so I wanted to share that with other people. So I opened my clinical practice a number of years ago. The first podcast I started was called Hypermobility Happy Hour. And then I started a second podcast called Bendy Bodies with the Hypermobility MD. And so that's the podcast that I have currently. And I love sharing information through that mechanism because it is so accessible.
Fantastic. Thank you so much for that introduction. And just a note for our listeners, we will make sure to link all of Dr. Blustein's previous episodes in the show notes so that you can catch up on those discussions as well. Today, however, we're going to shift our focus to debunking some of the myths and misconceptions surrounding hypermobility. And I think it's important, if Dr. Bluestein, if you could provide our listeners with a brief overview of EDS and HSD.
Definitely. So I'm going to just start with the definition of hypermobility. So hypermobility means that a person has a joint or a group of joints that has greater than expected range of motion. And that's based on the person's sex, age, etc., because we know that those things do influence joint range of motion. And that's different from joint instability, when the joint has an abnormal amount of motion in a different plane and difficulty staying in proper alignment. So there's joint hypermobility and joint instability, and you can have both or one or the other. And if you have this joint hypermobility and or joint instability and have symptoms associated with those conditions, then you fall under the umbrella of symptomatic joint hypermobility. And we know that the hereditary disorders of connective tissue are often associated with symptomatic joint hypermobility. And the Ehlers-Danlos syndromes are the most common type of hereditary disorder of connective tissue, with the hypermobile type being the most common. If someone has symptomatic joint hypermobility, but they don't fit into one of the Ehlers-Danlos syndromes or have some other condition to explain their symptoms, then the default diagnosis is hypermobility spectrum disorders.
Okay. As I mentioned, I know there's a lot. And even though I've talked to you, this is our fourth time, it's still evolving, as you said, and there's always new things to learn. So as I mentioned to our listeners, you can go back and listen to some of our previous podcasts on the show where Dr. Linda Bluestein goes into a little more detail on all of these things. But for today, could you please share your perspective on the prevalent myths and misunderstandings that surround hypermobility that you often encounter?
Sure. So the first few that I'm going to mention actually pertain to pain. So the first myth that just drives me absolutely nuts, and I actually do see doctors still writing this in their notes. They will call, hypermobility spectrum disorders, they'll refer to it as benign hypermobility or benign EDS or something like that. And these conditions, though, do very frequently cause pain. So the myth that EDS and HSD don't cause pain is definitely still really prevalent and is really, really problematic. And I would encourage any of my colleagues who might be listening to this and or any patients or physical therapists that are listening to this, if you have someone with pain and maybe there's difficulty identifying the source of the pain, or maybe they've had persistent pain, definitely always consider that they might be hypermobile, because people with hypermobility do seem to be at increased risk of having persistent pain. And once we identify that they're hypermobile, we can really come up with a better treatment plan. So that's the first myth. The second myth is that pain relief is not possible. And of course, having a pain medicine practice, I'm going to completely disagree with that, because I have found a lot of methods that can really help improve pain levels and improve functional capacity in my patients. And then the last one that relates to pain specifically is that pain care means that a person either gets opioids or nothing. I see this happen quite frequently where people talk about, pain medicines and they think that it's either opioids or nothing at all. And again, that's simply not true. We can borrow medications from other specialties of medicine, and there's a lot of things that we can do in order to improve someone's quality of life, either by using medications, by using supplements, doing a variety of different things. Some of the other myths that I find most commonly refer to the diagnostic process. Some people think that only geneticists can diagnose EDS and HSD, and that's of course not true. There are a number of other specialists that can diagnose EDS and HSD, but it is important for people to be aware that making these diagnoses requires training and it also takes time. So if you go to a physician who is not familiar with these conditions, it probably is appropriate that they're not going to work you up and diagnose whether you have EDS or HSD. And hopefully that person will be able to refer you to someone who can do that evaluation. That person might be a geneticist, but they might not be. And right now, a lot of people who suspect that they have hypermobile EDS, they're finding that either genetic practices are not accepting patients at all that suspect hypermobile EDS, or the wait list is extremely long. So that's why this is so important for people to know that it's not just geneticists that can diagnose these conditions. Another important point that I want to make is that some people think that if a dancer or another athlete has EDS, that they cannot possibly do their sport. And this is not true. There are dancers there are other athletes that have EDS and are still doing their sport. We know that dancers are incredibly strong people, and that they will often, push through pain and other symptoms. And so they often will still persevere, even though they are struggling with a variety of different problems. And sometimes they're more severe and sometimes they're more mild. And then I think the last one that I want to mention, actually, I'm sorry, two more if I could. One is that there's a myth that everyone with EDS has a Marfanoid body, meaning that they're thin and tall. And that is simply not true. Yes, there are some people who have hypermobile EDS who have a very long wingspan, meaning that they're from fingertip to fingertip is quite long, or they're quite tall, but this is definitely not something that everyone has. And the last thing that I want to point out is that a lot of people still think that EDS and HSD are rare. And although we don't know the exact prevalence because the nosology or terminology has changed in recent years, these conditions are definitely not rare.
So I think I counted 7 myths that you wanted to debunk or talk about. And I can already sort of see how those myths can lead to the misunderstandings, and also how that can have an impact on the dancers or acrobats with hypermobility disorders. So how, in your opinion, how did these myths and misunderstandings impact those individuals with hypermobility? And could you share if you've had some examples that you've come across?
Definitely. So the fact that a lot of people think that EDS and HSD are rare means that a lot of people are still not looking for these conditions. And so, when we went through medical school, we were taught, if you hear hoofbeats, think horses, not zebras. So we're taught to look for the common things before the uncommon things. And that's fine. Like, we should look for the common things first. But if somebody is still struggling with their symptoms or having problems, persistent pain, etc., then we definitely need to be opening our minds more and thinking of other things that could be impacting the person's quality of life. And I really see this a lot. And there's also some people who I have seen go to a number of other doctors, and I'll get a copy of those notes. And even if they acknowledge that the person has hypermobile EDS, for example, it seems that they don't often appreciate the impact that that condition can have on the person's health, because symptoms can occur both in the musculoskeletal system. So that's where you can get joint subluxations and joint dislocations. Again, with that joint instability, you can end up with joint malalignment. So you can sublux or dislocate a shoulder, for example. And so oftentimes I feel like even if other healthcare professionals, if they do acknowledge that the person has a hypermobility disorder, they don't necessarily understand that, okay, they have these musculoskeletal symptoms, but they also have gastrointestinal symptoms. Because if you think about it, connective tissue is all throughout the body. And so the gastrointestinal symptoms definitely can be related to the connective tissue disorder, because we have connective tissue in our gastrointestinal tract. So that can lead to slowing of digestion, that can put us at more risk for heartburn, that can cause constipation. Gastroparesis is when you have delayed gastric emptying. And so a lot of people if they have gastroparesis, for example, then that also puts them at risk for something called SIBO, or small intestinal bacterial overgrowth. So I think that, I see this happen all the time, where somebody will be working with a particular physician and they, again, don't connect those dots. And it's important that we do connect the dots, and that we understand that at the end of the day, there is usually one root problem, and that's the person's connective tissue. And where we can't necessarily fix their connective tissue and fix their underlying genetic abnormality, if you will, we can at least do a variety of things, sometimes with their nutrition, working on like neuroscience education, working on better movement patterns, working on different psychologic skills, medication supplements, working on their sleep. These are some ways that we can improve their quality of life.
And I know Dr. Bluestein, that you feel the same way that Acrobatic Arts feels, that if we can even reach one person, right? One
Right.
person out there that's listening, that either themselves or they know someone that might be going through this, all of this information is so worth it.
Definitely. And I do want to, if I could give one other example, because I just thought of a really great example. So I was actually in a hot tub the other day and met this person who was a gymnast and had had multiple ACL tears and a variety of other injuries throughout their career, but had never connected things. And we're just like literally sitting in this hot tub. It's like her family and my family hanging out in the hot tub. We didn't, not intentionally together, but anyway.
Yeah.
So I started thinking, I don't remember why she mentioned about those injuries. Probably I started prying for a little bit of information, realizing, this seems like this could be a thing with her, right? And so I ended up telling her about my podcast, and she was shocked. She was like, oh my gosh, this is a thing. And this is a full-fledged adult. I won't say the age in order to, not that anyone's going to figure out who this person is or anything, but just to make it as anonymous as possible. This is an adult person who really shared with me later that she went back to her hotel room and cried because she had no idea that she wasn't to blame for all of these injuries that she had encountered and for all of the symptoms that she had diffusely throughout her body. And it was so eye-opening. And she's actually come to see me since as a patient. And so it was really eye-opening for her to get that information and realize it's not my fault, because a lot of people they think it's their fault, especially I feel like as dancers, as acrobats, we're perfectionists, right? We want to do everything just right. And so if things aren't going perfectly, we sometimes do blame ourselves.
That's an amazing story. And really, it hits home that we do just want this information to get to as many people as we can. And to be clear, you don't start all of your consultations in a hot tub, but
no, definitely not.
but you never know, that might open up the doors for some people. So sometimes it doesn't matter where or when, as long as this information's getting out. So considering the wealth of misinformation out there, what strategies do you find most effective in helping individuals distinguish fact from fiction when it comes to hypermobility?
So I recommend a few things. First of all, look for the person's credentials, especially if you look for the initials after the name. If they have an MD, then that means they're a medical doctor. If they have a DO, they're a doctor of osteopathy, and the education for those two is fairly similar. If they have a PT, then it would say PT after their name. If they have a doctor of physical therapy, it will say DPT after their name. If they are being a bit cagey about their degree, that's very important. I find that that's true a lot of the time when I'm working with patients and they've seen some other provider and I say, well, what's that provider's background? And they're like, I don't actually know. And so I'll go to that person's website, and sometimes it's actually hard to find, is this person a APNP or advanced practice nurse practitioner? Are they a PA? Or maybe they're none of those things. So it's really important to look at the initials after the person's name. Not that that automatically makes them credible or not credible. There are some fantastic people that have a different type of education than, for example, people with an MD degree. I feel like I'm seeing more and more, unfortunately, of my colleagues who are doing things that I consider, for lack of a better word, a little shady, which is disappointing. And it seems to be motivated by, the commercialism and the business of medicine rather than what we tend to think of as the practice of medicine. So first I would look for the initials after the name, keeping in mind that that's not the end all and be all, but definitely look for that. And then you also want to look for conflicts of interest. So are they trying to sell me on some really expensive, products and services that don't seem to really fit with what's the norm? Are they using words like cure, for example? If they're claiming that they can cure hypermobility or hypermobility disorders, that to me is a big red flag. So definitely be looking for that. Also look to see, where did this person get their information from? If you are able to see, or when you call, if you call to schedule an appointment or something, I would definitely ask what other things this person does. So if hypermobility is like one thing out of 100, and the other things are not related, by the way, to hypermobility, then that's very different than somebody who really focuses on hypermobility, or at least seems to have more education when it comes to hypermobility. For example, if they've gone through the EDS ECHO program or the Ehlers-Danlos Society ECHO program, then to me that gives them a lot more credibility than somebody who has not gone through that. And who do they affiliate themselves with? So I think that's also really important to see, are they affiliated with or are other people recommending them who also are knowledgeable and credible, or do they seem to be affiliating themselves with people who are not as credible?
Great advice for everyone out there. Dr. Bluestein, as we wrap up our discussion, is there anything else you'd like to share or emphasize for our listeners?
I think the thing I want to emphasize the most is that there is hope. I feel like a lot of people, myself included, when we don't know what's going on, or when we are newly diagnosed, or if we've been struggling and suffering for quite some time, it is very easy to start feeling hopeless. And that's a terrible feeling. It's very, very frustrating, and it's easy to get really discouraged. And that really feeds into our symptoms, though, because when we feel discouraged and hopeless, our nervous system tends to get more activated, and that will contribute to our pain. It will contribute to poor sleep, and it might contribute to anxiety, which is another thing that's really, really common in people that have joint hypermobility. So instead, I would really, really encourage people to check out my podcast. Definitely check out, of course, the other interviews that I've done for Acrobatic Arts. Check those out first. But then also, please check out my podcast, Bendy Bodies with the Hypermobility MD. The whole goal of the podcast is to give people as many tools as possible in order to improve their quality of life, on their own. And it's at no cost to the listener. So long as you can access either a computer or if you have access on a phone or some kind of device, people can then listen to the podcast. And it's also on YouTube, by the way. And the more recent episodes do contain more visuals. So I encourage people to watch those videos on YouTube. And I think that it's just so important to keep that hope alive. And I really hope that this conversation is helpful for people in that way.
I'm so glad you mentioned the YouTube videos, because I actually was doing some research before this podcast, and I saw all the YouTube videos, and I was wondering what the difference is.
And actually, I'm really glad that you asked that question, because so the first 73 episodes of the podcast, I did record audio and video, but I was recording on a different platform, so I didn't upload the video onto YouTube. Starting with episode 74 until coming up, we're like in the mid 90s now. Those episodes have the actual recorded video on YouTube, and sometimes the guest would be either showing something on a chart, or they would be using their hands to demonstrate something, or they might pick up, like for example, they might pick up a brace or some other visual aid in order to explain more what they're trying to demonstrate on the audio. So that it's the same thing on the audio and on the video, but the video contains those visual aspects. And I also want to take this opportunity, if I could, to explain the pivot that I did with episode 74. Up until that time, I wanted to start out with the podcast being focused really on performing artists. And so the first 73 episodes, there is quite an emphasis on performing artists. Not all of them, but a lot of them. But I also got some feedback that it was a bit confusing for listeners. So starting with episode 74, it is more medically focused. The podcast is more medically focused, but at the same time, if people go to the website, which is www.bendybodiespodcast.com, there are categories. And so you can search by category now. So you could go to, is it performing arts? It might be dance. I'm not sure exactly how I have that labeled, but you can specifically look for the dance, acrobat, performing artist episodes You can look for episodes that specifically mention mast cell activation syndrome, for example, or ones that specifically mention dysautonomia. And so those categories hopefully will help you find what you're looking for more easily. And episodes every episode actually includes multiple categories. So you'll see some overlap. Like if you look at the dance episodes and then you look at the mast cell activation episodes, you'll see that there's definitely overlap there. But I tried to pick, the relevant categories for each episode, if that makes sense. Hope I explained that okay.
Yeah, that totally makes sense. And congratulations on how well your podcast and the YouTube videos are doing.
The feedback that I've gotten is really incredible. I mean, I get really touching emails from people, and the comments on YouTube and elsewhere on social media are really, really powerful. And so I really do hope people will share the podcast with other people, because there are way, way more hypermobile people on this planet than most people realize. I mean, estimates are that overall about 20% of us are hypermobile at least. And in the dance population, it's like 90% plus, especially if you look at like elite ballet dancers, for example. And of course, if you look at acrobats, it's going to be very, very high there as well. Very high. I do want to, if I could mention one other thing really quick.
Sure.
People often compare themselves to other people. So if you're an acrobat and you're looking at other acrobats, keep in mind that most all of them are hypermobile. So just keep that reference when you are thinking about, oh, could I be hypermobile or not? That this is, compared to other people your age and your sex, et cetera, not compared to other people in your acrobatic class, or, other people in your, pole class, or, doing various different activities. Probably if you're selecting out that population, there's going to be a lot more people that are hypermobile.
Dr. Linda Bluestein, I want to extend my heartfelt gratitude to you for taking the time to be a guest on our podcast. Your passion for EDS and HSD always shines through, and it was very enlightening to hear your thoughts on the myths and misconceptions. As always, the Acrobatic Arts podcast is incredibly thankful for your willingness to share your expertise with us, and we look forward to staying connected and, of course, hopefully collaborating again in the future.
Me too. I can't wait to do that. Thank you so much for having me. I love chatting with you, and I just love the work that you're doing. It's so, so important.
By raising awareness and deepening our knowledge of EDS and HSD, we can better support individuals with hypermobility and improve their quality of life. Don't forget to subscribe to our podcast for more engaging discussions and expert insights. We'll be back soon with another exciting episode. Until next time, stay curious and keep exploring the world of health and wellness. Thanks for listening, everyone, and have a great day.